Good morning, everyone. So, amongst us, we have an amazing pioneer of the dental industry, Dr. Krishna Nayak, who is the Dean and the Principal of E.V. Shetty College. Welcome to the platform, Medula, sir. It's
Thank
a
you.
huge honor for us to take your interview.
Thank you very much.
So, my first question to you is that, and I'm very curious to know about it, is there any story behind choosing orthodontics as your profession?
I won't say that it is a story. Before I answer your question, let me just congratulate JSL Education Institutions for starting off with this concept of Medula. What does it say? Leashing aspirations. I think it's a very good, very nice idea, and I understand this is about 2 to 3 months old. So wherever, whenever there is someone of repute visiting your institution, you take an interview and probably upload it on YouTube, I was told, for everyone to access. So having said that, congratulations. Congratulations to your chairman and the principal, Dr. Sunil Ganta of the Dental College, who I understand is the pioneer behind this, whose brainchild this Medula is. So coming back to your question, there is no story as such, but having said that, those days, there was only one private college, that is Manipal. In the whole country, there were 15 colleges. Today, we have 315 colleges in the country, roughly. And only one private college those days when we studied was Manipal. And I missed out on a government seat with very narrowly. Those days, we never used to get 90s and 100s. I was in early 80s, but I missed out a government seat. And whatever it is, no regrets. Joined Manipal, finished my BDS, did my internship at Chennai because there were a lot of patients there, let me be very frank. And I was in the family of dentists. My father was the first qualified dental surgeon in Bangalore, and it was a family practice, and obviously he was my hero, he was my inspiration. So I took up dentistry looking up to him. And then after finishing dentistry, then and even now, orthodontics is one of the most sought after specialties. Even so, those days, the whole of Bangalore, for example, had only one orthodontist. So I did orthodontics and joined the family practice, which that time itself was almost 40 years old. So that's how I took up orthodontics, and those days it was a 2-year program. Let me just add here, though your question is not directed towards that. It was a 2-year orthodontic program, PG program, and it is now about 37 years since I am in this profession. 85 I finished my orthodontics. So I think I have answered your question.
So, in your 37 years of experience, is there any case that has changed your perspective regarding orthodontics?
No, orthodontics is a challenge, and it is very more than a challenge. It is very difficult to satisfy everyone. Every patient will have their own aspirations. I won't say aspirations, their own kind of something in the mind. This is how I should look and all that, which is sometimes not practical. We do our best and do our best for them, but at the end of the treatment, some people are not satisfied. So it has happened in 37 years. There has been one patient whom I have returned the full money. That because you said, is there any case you will remember? Remember only for this reason. Somebody else told them that tooth extraction was not required, and then they come back and say, why have you extracted? Wire was not even placed. So we returned the money, and that case, though it was in the beginning of my career, I'm still talking about beginning as in the 80s only, late 80s. So that case comes to mind when you ask this question.
So, ascending to this position of becoming a dean of E.V. Shetty College and being a leader, being an academician, being a clinician. So, what are your 3 major learnings that we dental students should be aware of?
Yeah, see, when I finished my master's program, the E.V. Shetty Dental College, of which I am the dean now, had just started in Bangalore in 85 only. So it was a very good opening for me. My own alma mater, of course, Manipal, was those days 60 kilometers, also very far. It's not like today you just get up and in half an hour or 45 minutes reach there. So, and they didn't have this Mangalore college, the Manipal group. Now they have a dental college in Mangalore also. That was 2-3 years after I started my career. So I got a good opening in AB Shetty. I joined there. We were just 2 or 3 postgraduate staff, and it was a pleasure to work with the management. And they were a very good management, very supportive management. And there was no reason, never, though there were 3-4 other colleges that started in Mangalore and had offers much earlier than I took over in AB Shetty as a principal. I had offers from other colleges to come and be the first principal and other things. But there is no reason to leave. Not that I never aspire to jump and become the principal somewhere. So we walked up the ladder from the grassroots level, and I am so very proud today. And even here in this college today, and I see when the inspections and examinations are going on, almost half of them are my own ex-students. It is so proud. We feel so proud when our own students rise up to that swan. So that satisfaction of being in the students, mingling with the students, understanding the students, guiding the students, that gives a lot of satisfaction to me in particular, and I think most of the teachers who are dedicated and passionate about their teaching.
So what advice would you give to the budding orthodontist?
Yeah, your question. Yeah, why is orthodontist? I will say dentist only. See, one thing I believe is, first thing, I'm sorry, I'm a very, there's nothing to be sorry about. I am a firm believer in, I'm a God-fearing person. And one thing I'll say, I tell myself in any situation, God, help me to remember that there is nothing in the world that I and you together cannot handle. With that thing in mind, I go ahead. Coming to the students, I believe prepare your students for a career, not just another class. It is not, everything is nothing about orthodontics. Orthodontics is a small part of your living. What you need to become is a person, finally a person who is successful in society. So it is not just orthodontics, it's how you make the other person feel, not just your patients. I'm talking about another person in society. He may not be related to dentistry at all. So at the end of the day, a person remembers how you made him feel, and not what you taught him, what's an Adam clasp and things like that. I'm sure my students will vouch for that. Okay, and largely, of course, punctuality with a wee bit of passion. Passion is required in anything you do, and that is the mantra for success. You have to be passionate about whatever you do, and have that humane and this feeling towards other person. Don't treat him as an object. Understand his feelings. Remember that he is someone who is also has got feelings like you, and try to empathize with them. That is very important as a clinician. I told you first initially as a person, administrator, and now as a clinician.
So the world is changing, the technology is expanding, and the new things are coming up every day. So for us, what advice would you give to the current generation students, whether we should focus on gaining our skills, or whether is it gaining a knowledge, or whether we should focus on research? What is that one thing that is going to take us ahead?
See, what you said is things are really moving very, very fast, the technology. Today what is relevant is tomorrow obsolete. Okay. Similarly in orthodontics, if I may just, what comes to mind straight away is the clear aligners and things like that, which have come today. And unfortunately, they are now almost available across the counter, which is not definitely we as Indian Orthodontic Society, or personally me, I do not approve it, because there is something without a doctor, bypassing a doctor, you can't give an appliance to a patient and expect him to correct his problem. There is no one single remedy for all the problems, orthodontic problems, though they claim that aligner can do it. So basically, have your basics very strong, basics in orthodontics. Whatever comes, you have to add it to your alma mater. whether it's a scanner. See, lingual orthodontics came about 2 decades back in a big way. They were talking of lingual. As fast as it came, same speed it went off. Suddenly we forgot about lingual. So like that, then this transparent braces came, ceramic and other braces. Oh, even the wires were colorless, tooth colored wires, etc. So now it has gone one step ahead, no wires at all. When I am talking about, I don't want to mention brand names, clear aligners. So Invisalign, of course, is the king in the market now, and yes, we need to know what it is basically and have to move on with the times. You have to keep yourself equipped, otherwise tomorrow you will be left behind. So let us not go into the controversy part. Finally it is going to be, if you given a choice, I wouldn't want braces. If something, a very light and transparent and inconspicuous appliance can change my smile, any patient would opt for that. So you have to keep pace with time.
So my last question to you is that, so you have so many awards, you have so many achievements under your hat, but what is the greatest achievement of your life until now?
No, as you rightly said, God has been very kind. It is not that I have gone behind any awards at any point of time, but awards have come, and even now, I should say, from time to time, recently they considered me old enough to confer the Lifetime Achievement Award, so which I was jokingly telling, this is to say, okay, this is your last award, go and sit in a corner now, jokingly on the lighter side. But what definitely is touching is when your peers, when your institution where you studied honors you. In the Golden Jubilee, out of the half a dozen people in college, Manipal College, were honored, felicitated. I am proud to say I was one. That is one honor, one award among many others. I got the State Honor Rajyotsava Award, which is much bigger, but I would consider this one being conferred by my alma mater to be the should I say most gratifying and satisfying, and really I was euphoric about it. And the people also, incidentally, who were felicitated along with me were really big names. So that made me feel even more better receiving that honor.
Thank you so much, sir. It's a huge privilege for us to take your interview and know about your journey and the stories and the advices. So thank you so much for sharing.
No, I thank you so much. I should congratulate you once again. I'll be failing in my duty if I do not do that for starting this, Medula, and I appreciate this. And along with this, there are so many things when I discuss with your principal, who is incidentally also a student of mine. So he tells me about a lot of things that you people do, about so many innovative things. So innovation, I think, is your forte. Innovation seems to be the forte of GSL Dental College, at least. Even the college is only one of very few colleges which has got this state of the art equipment. Especially, I am referring to the simulators and all that, medical simulators and the dental simulators also, which have added recently. So it is there in the forefront. And again, all this wouldn't have happened but for somebody's passion in this and the support from your chairman. We may want something, we may try to convince them, but if they are not reciprocate, they don't reciprocate, they don't support you, you can't do anything. So I've been lucky to be under a management or with a management which has all through supported. That is why, if you ask me, 37 years, I have not even considered moving out of there. So congratulations once again and all the very best.
Thank you.
Thank you.